So our third speaker is from the University of Cambridge, Dr Muzaffer Kaser from the Department of Psychiatry, and he's going to talk about a computational approach to reinforcement learning in patients with remitted depression.
Good afternoon. Thanks to Academy for the opportunity. So I'm Muzaffer Kaser. I'm a clinical lecturer at Department of Psychiatry, University of Cambridge. Today I'm going to talk about an important but overlooked area in depression, which is the reinforcement learning, a specific cognitive function. And in this study, we try to understand a feasibility of a pharmacological agent, Modafinil, and we used computational approach to analyze the underlying behavioral patterns in the reinforcement learning task. I would like to start with the cognitive problems in depression. So when we talk about depression, people might think low mood, sleep disturbances, appetite problems, but one of the most persistent problems in depression are cognitive problems, like memory difficulties, concentration problems, and decision-making problems. And in some of the studies with the follow-up, the cognitive problems are the most persistent problems in depression. One of the important elements is that cognitive problems do not respond to antidepressant treatment, so there's a clear unmet clinical need. Modafinil is originally licensed for narcolepsy, and it has established beneficial effects on cognitive functions in different neuropsychiatric conditions. Modafinil essentially modulates dopamine and norepinephrine in critical brain circuits that are implicated in cognitive functions, and especially in reinforcement learning and decision-making. On a day-to-day basis, we are involved in decisions, and our brains make a model of the world and constantly updates this model by using the information from the environment. And essentially, the brain uses the rewards and losses to update the information. And healthy people usually go through the reward maximization and minimizing the loss. But in depression, this might not be the case, and the very simple decisions might be very difficult. So, as I mentioned, the optimal decision-making is crucial to maintain daily activities, but in depression, there are studies that showed the reward-based learning is impaired. There is somewhat blunted reward response in depression, and there is problems in avoiding the loss. And more interestingly, these difficulties can persist even after the mood symptoms recover, which make the life even more harder for people. It brings the distress, and this could lead to vulnerability to relapse. In my clinical practice, I often hear from the patients saying even the simple decisions like going out for a coffee could be a catastrophic process for them because there are too many options, and they're not in the position to prioritize the rewards and the potential losses. So when I think about the losses and the responses to losses, I remembered Eeyore. Eeyore meets Winnie the Pooh, and Winnie the Pooh realized that Eeyore's tail is missing. And he says, "You must have left it somewhere," said Winnie the Pooh. And Eeyore says, "Somebody must have taken it." And after a long silence, he says, "How like them." So that's the type of indifference to losses and not making the move after losses we are trying to model and tap into in clinical depression. So in this study, we used a double-blind, randomized, placebo-controlled design with parallel groups. So there were 59 patients with remitted depression. We specifically selected people with remitted depression because we were interested in the persistent cognitive problems, and they received either a single dose of modafinil or placebo. And they completed a set of cognitive tasks in the clinical research facility in Cambridge on memory, attention, and also they completed the reinforcement learning task, which I'm going to talk you more in detail. And the groups were well matched in terms of their demographic characteristics and also their clinical characteristics. So essentially, the participants were seeing something like this when they are doing the reinforcement learning task. So they presented with two circles on the screen with different colors, and each time they're asked to make a decision and find the better circle. And then the next time, they're presented with different colors, and again, they're asked to find the better one. So when they make the selection, they see something like you win 50p, or you didn't win anything, or you lose 50p. So basically, over time, over repeated attempts, they learn by trial and error. And the task is designed in a way to accommodate different scenarios. There is a no-lose condition block where they either win 50p or they don't win. And there's a no-win condition where they either lose or don't lose. And it's not a 50-50 deal. The probabilities are set to 70 to 30. So there is the contingency that the participants will need to learn from. And the advantage of computational modeling in this task is we can identify the latent variables in this learning process. So normally, you would end up getting the outcome measure of the monetary gains. But with the computational modeling, you can add different elements to it. So how people are learning and how people are responding to losses or gains. So this gives the extra advantage. In the computational modeling we used in collaboration with UCL, we revealed two behavioral parameters. The first one is the learning rate. It is the size of adjustments that are made to adapt to new information. So essentially, how you learn the task. And the second one is exploration after loss or gain. So it's also called choice stochasticity or temperature in the literature. And this is a measure of exploration in response to decisions. It is what you do, what action you take after you face a loss or a gain. And the results show that participants receiving modafinil were more active in terms of their exploration after losses compared to patients receiving placebo. So the patients receiving placebo were somewhat blunted in their response to losses, while patients receiving modafinil were more exploratory. And also, this difference in exploration after losses was correlated with monetary gains and attention performance in the modafinil group, but not in the placebo group. So to conclude, we showed that modafinil worked towards an increased exploration. In other words, searching for less punishing or better opportunities. And we used the computational modeling to reveal the latent variables in this task. And the study showed feasibility of modafinil use to address decision-making problems in depression. And the main implication of this feasibility study is that the improved decision-making cognition can lead to better outcomes in patients with depression. I would like to thank my collaborators, especially Dr. Wilson Walton from UCL, who we worked through the computational modeling, and all the collaborators who made this study possible. Thank you very much.
Okay, questions? Yes, Chris.
Are there any comparable data in people without depression?
Yes, the modafinil was shown to have beneficial effects on reinforcement learning task, yeah.
And how did the baseline compare? How do people without depression score on your scores without modafinil compared with the people with depression treated, etc.?
Mm-hmm. So can you please repeat that?
Well, you've shown a difference with modafinil,
yeah,
with an improvement of people with depression from a low baseline to a higher level. Mm-hmm. How does that improved condition compare with normal people who have never had depression? Not that I'm saying that depressed mm-hmm. people are not normal, they're a spectrum, mm-hmm. I recognize.
Okay. So obviously when we talk about depression, there is already a blunted effect. So you suggest that the blunted effect might mean that modafinil can give a better edge to patients who already have reinforcement learning difficulties. Yeah. So I cannot comment on the exact parameters because there are different computational modeling parameters that are used. But the studies using reinforcement learning tasks show that modafinil can improve the performance, not using the exact model that we used.
Yeah, Peter.
So what are the next steps? I mean, should we be just using modafinil?
Yes. So the next step would be to see whether this effect can be sustained in a longer term study. And also another angle could be using this task with the computational modeling to repurpose different drugs that can address decision-making abilities in people with depression.
Sorry, one more. Where did the 59 come from?
So there were 30 patients in each group, but for one patient, the data was lost. That's why they ended up in 29 versus 30.
Sorry, how was it powered in the first place?
Yeah, so we did the power analysis by using the previous studies using similar cognitive tasks, and the power analysis yielded a sample size of 30 in each group.
Just wondered, out of curiosity really, I wondered how one explains such a large placebo response and whether that is comparable to other clinical trials in depression. Is that a standardized level of placebo response in depression?
Placebo response traditionally.
Yeah.
Placebo response traditionally has been quite high in depression, and this is one of the main criticisms of clinical trials in depression. So that is quite expected in patients with depression. Yeah.
Any other questions? The model you have for the sort of decision making, obviously it was a human model. Are there sort of similar models that you can use in animal studies to try and understand a bit more about the kind of
Not that I
brain
know
chemistry?
of, not that I know of, but I would presume there might be some primate models, not the rodent models.
And do you understand, or is it understood, the sort of biochemical effects in the brain that the drug is having?
So modafinil affects several neurochemical systems, but mainly dopamine and norepinephrine.
Okay.
So from both preclinical studies and clinical studies with using imaging techniques and PET, in terms of the target engagement, we can see that the modafinil increases the dopamine availability in these critical brain circuits. So that's one of the things.
Yeah.
But also there are other effects on other neurotransmitter systems, such as glutamate.
Okay. Great, good. Any more questions? No, thank you very much indeed.
Thank you.
you.
Thanks.